Right now, the executive director for People's Dialogue on Human Settlement, Farouk Rabiu Braimah, joins me via Skype now. Now, he doesn't agree with the calls for a lockdown, but let's find out why. Hello, how are you doing?
Yeah, I'm fine, and you?
Not bad at all. I'm glad to speak to you. Now, you've been on the ground, you've been interacting with people, and your conclusion is that a lockdown is not the way forward. Tell us why.
Thank you so much. I think at this stage, it's not about right or wrong. We are not against a lockdown, not at all. Lockdown is appropriate if the timing is right. I think the problem has to do with what just my colleague from Jamestown just articulated. You see, we have very peculiar challenges in some communities, and I think we should just prepare ourselves properly, some form of targeting, some geographical targeting, to identify communities that are mostly going to be affected by this and prepare them before the lockdown. I think that's exactly our call.
That's a fascinating thought. So you think that under the right circumstances, a lockdown would be okay. But what would those circumstances be?
Okay. Let me just give a typical scenario. You have a community like Old Fadama, where you have about 120 people living in that area. You have about 20,000 households, and people live 8, 10 in a room. The place is overcrowded. They have a very communal lifestyle. They share toilets, they share baths, they share their rooms, and they share their eating spaces. Now, these kinds of communal living makes lockdown and isolation practically difficult. It doesn't mean that it is not possible. So I'm just saying, what we're saying is that let's begin to have this conversation. Let's act. We need a lot of data. We need household data. We need data about communities. We need to find out how many people, how many children, how many women, what is the family size, so we can plan an intervention. We feel strongly that once we are able to identify these hotspots and the flashpoints, and we intervene, if I say we, I'm being very careful not to place the responsibility on government alone. Government alone can never do this. So again, government has a lot of activity to do at the macro level. The research, the facilities, the hospitals, and paying people on the ground, government is already overburdened at the top. Non-state actors, yes, please?
No, please go ahead.
So we expect that all hands must be on deck. The non-state actors must come in, the international NGOs must come in, the local NGOs must come in, the private sector must come in. We cannot sit back and expect government to move into communities and provide everything to households. That would not work. And so I'm just saying that, sitting from where I sit and what we have been doing in the communities, we've started a very simple, non-expensive approach. There are two approaches here. We have the hardware component side of the program and the software side of the problem. I think we're focusing too much on the hardware, which comes with capital cost. Our proposal is that we should have a community-led response and management to this problem. What does it entail? You need to set up community structures where they have a certain leadership who can then coordinate and interface with national efforts. Fancy that government wants to give 100 sanitizers to Choco. How are they going to distribute it as we sit? So we need to, first of all, put in place the software component. Let's have community structures. Let's have community coordinators. Let's have volunteers. Once you begin to create those structures, from outside, communities look homogeneous. But when you move in, there are differences and stratification. So we are just proposing that let's begin to look at low-hanging fruits. There are quick impact programs that we all can get ourselves onto. Every Ghanaian, the president has shown the way. He has called every Ghanaian to take personal responsibility. And I think that is enough.
Right.
We have seen personal commitment from government. And I was so impressed, my brother, yesterday, the day before in Old Fadama, when I had to encounter the Minister for Local Government. She walked into the community. We had a one-on-one with her. I could see commitment. I saw Honorable Atechia with us. We were with Honorable Nitiwu in the community, and that was so interesting. Now, these kinds of commitments and interventions would all spur people on. to contribute their quota. Please let us not sit on the fence.
Mr. Braimah, let me ask you this. What you're describing, this sort of software approach, where there is a need for community representation, permit me to ask, does that not already exist? Don't we have assemblymen? Don't we have district administrative structures? And then further up, we have regional and so forth. Is the structure already not in existence? Can we not use that?
Thank you so much. We need to enrich. There are some structures existing, but we need to enrich the process. We are in a very difficult time, and I think we're beginning to misunderstand where we find ourselves currently. This is not the traditional emergency response approaches. This is not the traditional disaster response approaches. Why am I saying this? I think we are very familiar with the conventional mitigation framework. You mitigate, you prepare yourself, you respond, and then you recover. This doesn't allow that to happen. Why? Because if you want to deliver water, you are also avoiding events that amplifies transmission. So you cannot expect people to move in their numbers and congregate to access water. If it were just a normal emergency situation, you could just go in to deliver sanitizers, and people would queue to take it. We don't want to encourage conditions that will amplify the disease transmission. And so we are in very difficult times. We need social workers, community development officers must all move on the field, work with very vulnerable communities that are on risk. Let's identify these communities. Let's break them into clusters and begin to assist them in a way that we don't increase the spread of this disease. The assembly members, the unit committee members, the local authorities have been up and doing. We have to commend them. I can see people who really are committed to work. Again, we need logistics.
So
we have to encourage.
What you're describing is a sort of a system that will allow for pretty much door-to-door access to citizens, to provide them with whatever they need, to test them where necessary, to monitor a lockdown, if that were to be the option chosen by government. Now, what you're saying is that a lack of data makes that difficult.
Yep.
It almost sounds like this would have been a perfect time for us to have a census. Is that an option?
Not at all. I think some data exists. I need to say clearly, given where I sit, we're working in collaboration with the Zongo Development Fund, which was created to provide funds and support processes like this in communities. In fact, we are talking about social protection here. Now, for those of us who are practitioners in the field, social protection would only mean a public action that is meant to respond to a level of deprivation or risk, or vulnerability, which is deemed unacceptable. And we are saying that these conditions we find in the slums and zongos are unacceptable. That is one. Two, we are saying that the government and the ministries and agencies cannot go the full stream from the top right to community and households. And so there's a need for a certain connection. The assembly members, the unit committee members are on the ground, but we still need to create a certain system that allows a plug-and-play approach. So the government has to have a certain structure in the community that they can easily interface with, and that's exactly what we're proposing.
All right.
We are also saying here clearly, my brother, that the Ghana Water Company Limited must speed up its process of supplies of water. The low-income community support unit must be up and doing. They have to be supported to provide water. We are looking at the National Food Basket, NAFCO, to also intensify whether we're going to have some food balance in communities. We have to start thinking around this. We are talking about data. What are we doing about the price of data networks? Are we going to ask them to reduce the price of data so that we can have more of the virtual interaction that we are pushing?
Yeah.
So these are things that are very low-hanging. I think we should begin to embrace them.
Now, you've touched on a number of things. You've touched on utilities when you mentioned water and perhaps even toilets and so forth. You've also touched on the economic aspect of things. There is one aspect yet to be mentioned, and that's security. We know what happened in Jordan. They literally had to claw back their lockdown because security issues started to raise their heads. Now, let me ask you, from what you know of the way things are organized at the community level, And from what you know about our massive shortage of police officers, how would we even go about enforcing a lockdown and ensuring the security of all aspects of society while this lockdown remains for 14 or 21 days?
Oh, I think if you listen to my earlier submission, three things must happen. I feel strongly that at the community level, we need to create certain structures, okay? The existing structures are not able to, they are not fit for purpose. We need to enrich them. What do I mean by enriching? Remember that we find ourselves in a very polarized environment. Political parties, religions, tribes, ethnic, we are divided somehow. They are not so deep, but you have some divisions. Now you need a certain platform that allows all people, all manner of people and persons to work together towards the fight against COVID. And we feel strongly that that has to happen. And that's what we call the community coordinating committees. We need to have community coordinating centers. You know, it's very critical. Elsewhere, they call them the disease incident systems, okay? So that when people want to complain, they want to talk to people, they should know a central location in the community that you can reach out. It could be the assembly member's office, it could be the unit committee member.
But if we're on lockdown, we can't do that. If we're on lockdown and there's mandatory quarantine, you can't go to an office to you know, make a complaint, can you? Okay, virtual office.
Virtual space.
Can all Ghanaians access a virtual office?
But that is why we are saying that the social workers, community development workers, environmental health officers, and even the community volunteers, we have to dirty our hands. And I'm saying this because if we continue to expect just the trauma system to respond to this, we're going to be in serious crisis. I happen to have worked somehow in Liberia and Sierra Leone during the Ebola crisis. And I bet you, my brother, the slums and the highly populated areas were badly hit when Ebola found its way there. This is the kind of things we want to preempt. And so my motivation at this time and what I'm sharing on is that let's begin to build the structures and the capacities of the first responders, who are community people. Now, they have to work in tandem and under the supervision of the environmental health officers. We can train community leaders. We can train community volunteers. You cannot expect 60 environmental officers to be everywhere at any time, 24/7 in the whole of Accra. It's not going to work.
Is there time for that? I mean, we're talking about fast action here. We're seeing what's happening in other parts of the world where the numbers are multiplying exponentially. We want to try and prevent that. Is there time for training and capacity building and all of that before we actually take action?
I think training in this sense is also training within an emergency sense. So we are not discussing the workshop approach to training. This is taking the necessary precautionary measures away from the offices into the communities and tell community leaders that, look, you have this sense of urgency. There's appetite to work, but there is no agency to work. So you have a situation where people have the urgency and then they don't have the agency. So the environmental officers, professionals, could partner. And that's what we do in Ofadama. We have zoned the area into 6. For every 5 volunteers, we have 1 or 2 professionals working with them. And we feel that's the kind of approach that would bring total crash of this. In terms of the timing, I've listened to the debates, and I think they are mutually inclusive. Nobody is talking about which is right and which is wrong under these circumstances. I think what we should do is to begin to tackle this head on. Let's do them simultaneously. You are beginning to have a close down. Let's have a quick, rapid response to how are we going to handle such communities who will require some support. And I propose geographical targeting, because the government and the state can never, and we cannot expect the state to provide meals, soap, water for every household in Ghana. It is not going to work.
Okay.
So first,
well, hopefully not every household will need that. So perhaps you're right.